Hello, it's Dr. Dave Webster. I just attended a Surreal meeting, another meeting in a cancer head and neck rounds in this particular case. It's extraordinary. I'm sitting here in this hospital, and we're all educated professional physicians, and we're discussing these various cases. And one of them happened to be a person with a very large tumor in their base of their floor, the floor of their mouth, about a 4 centimeter tumor. And the debate was going on and on about whether little lymph nodes noted on the CT were of any concern or not, and maybe there was one in the middle of the chest and so on. And so once again, I piped up in the meeting and said, listen, this patient clearly needs an FDG PET scan. If this patient were in Paraguay, Turkey, you name any other country, their physicians would have known that what they needed was an FDG PET scan. It was extraordinary. These physicians are also aware that the College of Physicians and Surgeons is threatening me for talking to patients and physicians about these issues, about our unbelievably absurd and almost surreal situation of our lack of access to the proper indications for PET scanning. And yet, there was just sort of jokes being made and further discussion about whether these lymph nodes were possibly cancerous or not. And of course, I went on to point out that, well, actually, normal-sized lymph nodes on CT are routinely diagnosed, or show on FDG PET scans. They actually have metastatic disease, and that CT is basically the view from 10,000 feet, as it's been described in the era of functional image. And of course, the PET scan actually contains a low-dose CT without the risk of contrast material. And yet, no one, said, we need to do something about this. We need to be advocates of the patient. I was in another rounds, 6 months ago in lung cancer rounds, and talking to one of the thoracic surgeons. And it was another one of those elephant in the room situations. And I just simply said, listen, this patient clearly needs an FDG PET scan to follow this. Again, these inane, stupid debates about whether the CT was helpful or not, and so on, was of course useless. And the surgeon looked at me in the eye and said, David, that's not how things are done in Ontario. Now, that's fine, except that that's where it ended. After all these years, 15 years, I basically don't have a single colleague that is backing me on this. We've simply all resigned ourselves to the fact that the Ontario government, vicious and cold-hearted, really, they truly are quite willing to make victims and assault our patients with obscene doses of radiation, contraindicated therapies, delays in diagnosis, high-risk biopsy procedures that are not indicated, sometimes fatal delays in their actually managing their cancers, a huge increase in the emotional stress to these patients. Yes, we all know that's going on. We all know that Cancer Care Ontario and their colleagues at McMaster University Evidence-Based Medicine School are 100% responsible for this. And yet, in spite of them knowing that I'm now being threatened by the government, Cancer Care Ontario, and the College of Physicians and Surgeons for actually speaking out on this, I'm seen as the problem. That's why I say it's surreal. I don't know what it's going to take, but I'm going to do my best to keep doing this and showing people examples, and in the end, hopefully trying to use whatever I can on social media to finally expose what Canadian international PET experts started exposing in the year 2005 of the blatantly unethical, bordering on immoral, some have said evil, I agree, things that our government, Cancer Care Ontario medical experts, and those from McMaster University working with them are more than prepared to do to our patients. I've seen such horrible mistakes in suffering patients, which are directly the result of these policies. And Ms. Wynne has just simply blown them off, dismissed them, doesn't even acknowledge they exist. Same with Cancer Care Ontario, including the chairman of the board. They simply see this as a success story. Why? Because Cancer Care Ontario was told, you need to discredit, delay, and block PET. No one on the planet has done a better job. So how can that be? We live in a open, transparent, supposedly accountable democracy, and yet they've gotten away with it for 15 years. Nothing has changed. They continue to this day as they have all along, with impunity, and in fact, no one's even trying to pretend at Cancer Care Ontario there's any science behind what they do. They agree it's an agenda-driven process. They just don't care. They're quite willing to do whatever they need to do to make their political masters happy. So what does it say about the kind of political masters we have? Well, they simply represent the reason why people around the world have become so cynical and have such lack of faith and trust in politicians. So I'm going to change one way. I suspect it'll be me that suffers the consequences. So we'll just keep trying. Thank you.